Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, Christie Brinkley reveals her cosmetic procedures she has done. You're going to want to see this one because she looks great. And then, Chatgpt finds a cancer that doctors missed. Is AI going to take my job? And then finally, trends and strokes are shifting in the United States, and you're going to want to hear about it, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It really helps us out. I'm your host, plastic surgeon Dr. Bruce Hermann. With me is Sarah, as always.
Hi.
Hello, Sarah. Good to see you.
Yeah.
Trey in the box. What's going on, man?
Hello. I forgot to cut my mic on.
I know. I didn't hear you. I was like, "Oh, we're back on."
I can see the panic in your eyes.
I was like, "Whoa, we're on." Okay, no biggie, man. How you been?
I've been good. Everything been
Yeah,
straight.
I missed you guys last week.
Yeah, man.
It's totally my fault because I was gone the 2 weeks ago, and I forgot the studio was closed on Good Friday.
Oh, yeah.
Yeah.
And
forgot about that.
I happened to text Trey. I was like, "I'll see you in a couple days." He's like, "Nope, nope, no, you
I
won't."
had the surprise of not realizing Avery didn't have school either.
Oh, really?
Oh, dang.
Yeah.
Oh my gosh.
So I was like, oh, okay.
All right. Well, everyone gets a free day.
You with
Yeah,
me today, kiddo?
Yeah, yeah.
was
So
one of them.
you're going on vacation tomorrow.
Yeah, going to Mexico
Nice.
for a week.
For a week. That's awesome.
Yeah.
Any like cool things you're gonna do when you're out there?
We're going to that ancient city, Chichen Itza. And I don't know if I said that right, but I'm really excited to go.
it sounds right.
I wanted to go there last year when we went, when I went with a group of girlfriends. And last year we just did like the cenotes, but I think I'll get to do that again too. I think that's part of the
Wow.
the experience over there because there's a lot of cenotes over there.
Nice. Excellent. Well, I can't wait to hear full report. Trey, anything big on the horizon? No, just a usual weekend.
Nope, just
so
living
I haven't
life.
seen you guys since we did our motorcycle trip. So I'm gonna just tell you one story. I don't want to bore you to death, but like we were traveling through the desert out there by Big Bend, and I was trying to get somewhere quick to get ahead of the group. So I was doing about 90 probably, out on these roads in the middle of nowhere, and a roadrunner flew up and like just instantly hit my bike. And it was pretty big, but like when you're going that fast, like it just kind of comes apart, and like it just it got all on my visor. Like it was pretty wild. I was gonna like put a picture in there.
What
and
did
I
your
forgot
daughter do?
nothing.
She didn't even know.
No, she knew because it was like a loud thump, and then there's like feathers and like bird guts going everywhere.
It didn't like make your bike go like. "Ooh."
No, the bike just
crazy.
disintegrated it. But like it was pretty wild. Like I've never hit a wildlife before.
That's crazy.
That
I
is-
know. I felt bad. It was like really a pretty bird before it blew up.
You know what's even crazier is your tan line on your hands. You should show that.
This is actually better. Like, yeah, there we go. The tan lines.
That's funny.
I always put sunscreen on, but just out there so long that it eventually the sun overcomes you.
You
I don't think
wear
I've actually-
driving gloves.
I know. And I always do it. I always use sunblock, but it's just too much sun.
I don't think I've actually ever seen what a real road runner looks like a real life one.
I'm gonna send you that picture. You know what? I'll bring it next episode.
All right, for sure.
It's
They're not
like
as cool
well,
looking as the cartoon.
the cartoon?
promise.
Okay.
yeah, they're not as tall, but they're pretty big birds. Like its body is like this big, and so when it hit, man, it was like thump,
Oh,
and
God.
feathers, and
Oh, God.
yeah, it was quite the experience.
Right
But
on.
At least it wasn't like a deer or something.
Yeah, at least y'all stay safe.
Yeah, I
least
know,
y'all
right?
stay
Yeah, we were
safe.
So, all right, let's jump into some segments. So, if there's ever a person in this world I think sold their soul to the devil, I think it might be Christie Brinkley. Have you seen her like over the years?
No.
Really? You know
I
who
don't
she
really,
is, right?
Like I know that name, but I don't.
Okay.
Like if I saw her as a celebrity, I would be like, oh, she's a famous person, but I wouldn't
Okay.
remember her name.
Yeah, because she is a little bit more my generation than y'all's. Trey, you've heard of her, right?
I think so. She a model, right?
Right, yeah, she was a
Yeah.
model. She was in like the National Lampoon's Vacation movies as like the hot girl in the Ferrari.
Oh, I didn't realize that was her.
Yeah, that's
I used
her,
to love
that's
them
her.
movies. Oh, yeah.
So, I mean, she's looked amazing throughout the years. And every time, she hits a milestone age, like 40, 50, 60, 70, everyone's like, oh my gosh, she just looks awesome. So she's now 71 years old, and she recently revealed all of the cosmetic procedures that she's had to People magazine. And I thought it was like a good, it was an interesting article, you know, and she went into a lot of different kind of things that she talked about outside of cosmetics. But for our, you know, things that our audience, you know, like to know, I think that she had some good information. And so, you know, first off, when you look at her, you might think, oh, this lady's had tons of surgery. And so she kind of mentioned that surgery's not really been something that she's dived into. And I believe her, you know.
Yeah, because she honestly doesn't look that bad. Like, I've seen, like Madonna.
Right.
That's like the worst thing I've ever seen.
Right. When she had her alien phase.
Yeah. Like,
yeah, she looked like the Area 51.
This lady
she looks great.
She looks good.
So I'm gonna do a flashback because I want, you know, if like for you, Sarah, if you're not familiar with her, I want to like go through her milestone ages. And you guys tell me if I'm wrong, but I swear this lady made a pact with the devil. All right, throw up that first pic. This is her at 40. Mm-hmm. So sorry about the A's. I couldn't find one. I love that picture, but it had like these watermarks on it. But that's her at 40. I mean, she looks like she's in her 20s. Like she looks amazing. Okay, go to 50. Still looks phenomenal. Mm-hmm. Looks great. I mean, you could tell that she's like, you know, maybe I would say like late 30s, but you know, I wouldn't say 50. All right, go on to 60. 60 years old. I mean, that's not what I think of when I think of 60 years old. She looks phenomenal. Yeah. And then go to 70. This was her last year.
Wow. Still
looks great. And, you know, and the thing that I was going to mention about her in surgery is, you know, normally when people have surgery, you can kind of tell, like her 50-year-old picture will look older than her 60. And I think that she's aged naturally. It's just that she's aged very slow.
Yeah, she must be doing more stuff than just getting plastic surgery. Like, she's just probably taking care of herself.
Of course, yeah.
Better than
most. I agree. 100%
Exercise
agree.
And nutrition,
but
sure.
I do think that, you know, I think that when she says that she hasn't dived into surgery, that I believe that, because looking at her, and I looked at a lot of pictures, you know, to pull those 4 out. I mean, she has just this gradual progression of like aging naturally but slowly, and so she has to have some secrets. So she was on People magazines doing an interview, and she kind of went over some of the things that she's done, and she named 2 things specifically. The first one is she says she does do fillers, which, okay, totally can see it. You know, you can see it mostly in her cheeks. She doesn't have that natural kind of hollow out that people get in their 60s or even 50s, where their mid-face starts to fall, which then causes, you know, other wrinkles to form. And she doesn't have that. But the thing that she really said that she uses a lot is lasers.
Yeah.
And I can totally see that, because nowadays the lasers are way, way better than they used to be in the past. Because when I started plastic surgery in the mid-2000s, people talked about lasers. I mean, it was kind of a joke. You know, they just weren't that great. The technology wasn't quite there. And, you know, if 20 years ago someone had said that they were looking this young from lasers, I would be that, there's no way.
Yeah. I mean, you use lasers.
I use a laser every single year, and I'm open
good.
about it. It is. And, you know, and I am not that guy that's doing a lot of stuff. I've actually thought about using Botox. My office people
your girls at your office
they are hounding me. They're hounding me, man, to try it. And I'm probably going to try it, but I haven't yet. And we have amazing skincare products, and they hate when I say this. I am not like a skincare product guy. Like, I use sunscreen, which is obviously very important, but I'm one of those people, I wake up about 10 minutes before I got to roll out the door. Yeah. And I like in the shower out.
I don't think guys usually have they don't really care about a skincare routine. But
Trey,
girls do.
Trey, do you have a skincare routine?
I use a hot towel and hot water, and that's what it is.
Your skincare routine's like mine. Maybe splash some. Okay. Trey, you and I maybe need to turn over a new leaf, dude. I can hook you up with some product, if you need it. I got some.
I might take you up on it.
We should try. You know,
I honestly need to look at your stuff, because
We have some great stuff.
I put retinol and
Yeah, we have Skin Better, and my girls are gonna kill me because I can't.
Acid. All of that stuff.
I can't remember every single product we have, but we have what are considered some of the top tier products. I know Skin Better's one.
We'll have to look
I know Morgan's super mad at me right now. Anyway, Trey, I think what would be interesting is you and I, if you're willing, we should do a month where we try these products. Would you try it if I bought it for you?
Y'all should buy the headbands that they wear for the Get Ready With Me videos.
It's too much to remember.
Maybe we should start small, Trey. You and I maybe start with one product.
Okay, for sure. Let's do it.
You want to do it?
I'm open to it.
Okay, I'm going to text you. All right. How did I get off on that? Oh, yeah, the lasers. So I was like, I totally derailed my own conversation. No, I love the lasers. The lasers nowadays are really, really good. And there's different ones. There's ones that can do ablative, where it's taking off the top layers of skin to get fine wrinkles. There's ones that are penetrating that will actually cause collagen formation. And I did one treatment, and I was pretty shocked at just even one treatment, what it did for me. And so when you have someone like Christie Brinkley saying that, I like lasers, and also she looks amazing, I can totally buy it.
What are the lasers that like when it like goes on your skin, it almost looks like it's like tightening it like every time, and it kind of puts a mark on your face?
So there is like some of the fractal lasers do that kind of grid pattern. That's not the one that we have. We have the Halo, and so she actually mentioned Fraxel, and so I know about Fraxel. So Fraxel is a I think it's a non-ablative laser. So the difference being, so the ablative kind of takes off the top layers of skin, and non-ablative penetrate. So the one that we have, Halo, have you done one? You should do one. You should come try one. Yeah, you should come
I'll allow it.
I mean, I'll give it to you. You don't have to pay for it.
Okay.
Yeah, we'll take care of it. You should try it because, I mean, you're a little young for it, honestly.
Okay.
But you're not too far off because just maintenance. Like, it's one of those
But
things.
I bet it has levels though, right?
Of course it does. So like when they do me, because I'm like, oh, it's like, like you turn it up to 11. No, I told them, I was like, I want the highest. Like I want to feel the burn. But yeah, they do have levels. Anyway, so our laser is a hybrid laser, which does two things. Fraxel only does one, and so that's why I don't like it as much. And Halo actually is a little bit heavier treatment. And of course, when you get into like the heaviness of lasers, you do bump into the fact that there are some that have so much downtime that people don't want to do them.
Yeah, I think that's the one I've seen like on reels
Right,
and
so
stuff.
TRL,
it looks very like
your
can't
face,
go out in the
you look like a
sun.
burn victim.
Yeah, you can't go out in the sun, but like the after effects, their
It's amazing.
face, it looks like they had a facelift.
So so you're probably talking about TRL or some of the other CO2 lasers. So TRL is basically the Cyton brand. So we have Cyton Halo. So if we were going to get one of the heavier, we get TRL. It's amazing, but it's a 30-day downtime.
Yeah.
And so you have to balance, when you're thinking about doing a laser, like how long am I willing to look like a burn victim versus like how good of a treatment I want. And so we haven't dived into that yet, but as our med spa kind of grows, we probably will. But no, I do love the treatments. Fraxel's good. I prefer the Halo because it does like two things, but I can totally buy that she is not having surgery. And honestly, she has great genetics. If you have bad genetics, then it's really hard to get a result like she has even with treatments. So like, what has she done? The one thing she did mention, I know she's doing is Botox.
Yeah.
She's got no forehead wrinkles. She has a little bit of wrinkles when she smiles, but not a lot. So whether she's doing it now or part-time, like she's had some Botox at some point. Fillers I can totally buy, but lasers, I think that's what's doing the heavy lifting for her. So
I think we have a comment. Robert Dreschel, he actually said,
Thank you, Robert, for commenting. What did Robert comment?
We need before and after pics when you do the month challenge. He said he's in as well. So,
Robert, we could do maybe we have Robert on as a guest. And we can all do it. That'd actually be pretty fun. It'd be interesting because I don't think a lot of guys use a lot of skincare products.
No,
I don't think that's like super popular for men. But it should be because it really does make a difference. And part of it is cultural, right? Because I think society doesn't hold men to the standards.
Like they don't have a beauty standard.
Right. I think you guys get screwed, honestly, because it's just society expects that you're going to take perfect care of yourself. And as men, it's like, they're just kind of a slob.
Grow a beard and wear a hat.
Yeah, right. It doesn't matter. But okay, Rob, thank you for commenting, and I will take you up on that. So I think for her, we talked about Botox, lasers, fillers. The other thing is, and you mentioned this, she's obviously taking care of herself.
Yeah.
Like she's using sunscreen, she's using moisturizers, and she looks amazing.
Yeah.
So, all right, let me recap this one real quick, Trey. So today we were talking about Christie Brinkley, who looks absolutely amazing at 71, and she's just looked amazing at every milestone age, 40, 50, 60, 70. She always looks good. She was on People magazine talking about some of the cosmetic treatments that she had and kind of like giving an insight to what she's done to look this great. And first off, I think she has great genetics. That helps a lot. But she did mention that she uses fillers conservatively because she doesn't want to look overdone, which I think is absolutely the right way to go into that. And she uses a lot of laser treatments, which I've talked about on the show before. I love laser treatments. I do them every single year because they're very easy to do, little downtime, and they do a lot of heavy lifting to make your skin look great and also tighten and make sure that you age slowly. And I think that that's worked really well for her. I guarantee you she's also got a great skincare routine. She's protecting herself from the sun, using sunscreen, using cleansers, moisturizers. But yeah, if you want to hear more about it, then go look at the full segment. So, all right.
Yay, Christie.
Yay, Christie. She looks awesome. Okay. You know I love a good AI story.
Yeah.
You and I are both kind of, I don't know if like which one of us likes AI more.
You probably are more smart with it. I'm more of like, hey, I call him Chatty.
Chatty. You've
Like,
named
hey,
your
Chatty.
chat. So that is
Yeah.
actually very interesting. I have not named my chats.
Yeah, it knows a lot about me. Because one time I asked him one
Right,
time.
it has memory now.
Yeah, so I asked it one time, like, do you answer, like, so if I said, like, I asked it something and somebody else asked it the same thing, I said, do you answer it the same way for another person? And they're
No.
like, no, I answer it, like, generally the same way, but not with the same flair or vibe that I would with you. And it said vibe.
Wow.
To me.
And I
And I
could
was like, oh.
I could like nerd out for an hour here, but I'm going to give you a one sentence summary of what I would nerd out for an hour. You can actually go in and set those settings of the variability, like the accuracy and the variability of like how it responds.
Oh, like the
if you want.
tone and everything.
Yes.
It
Because it
calls
answers
me,
differently every time.
Yeah.
If you open 10 different windows and ask the same question, it'll answer differently.
Mm-hmm.
But it'll always kind of be like towards a focus, but you can widen that
General,
out.
yeah.
It's kind of crazy. But
it always calls me like girl vibe. Like
really?
Yeah.
It's
uses,
because
like,
it's
lingo that-
remembered some stuff. Trey,
Yeah.
I can't remember, are you a chat user?
I do use it. I
Use it
actually
for
use
work,
it for
though, right?
the radio show in the morning.
The
sometimes.
radio, that's right.
I
That's
come
right.
up with questions
Yeah,
and stuff
very
like
good.
that.
Okay, so diving into this segment, I love AI, especially Chatgpt, and this is a story about Chatgpt detecting a cancer that doctors allegedly missed, and that's the girl there. I didn't write down her name. I'll have to look it up. So sorry, ma'am, I forgot your name. But it's a pretty interesting story, and it kind of makes you wonder, are my days as a doctor limited here? So this is a 40-year-old woman who began having some troubles bending her fingers. Okay, that's pretty random. So I do hand surgery, so I know about some hand stuff, and I'm like, okay, that's kind of odd. So she goes to the doctor, goes to a bunch of doctors, and after about 4 months, the doctors, and this is all per her, so I don't know how accurate this is, because there's always two sides of the story, but her story is that after 4 months, they diagnosed her with rheumatoid arthritis, even though she says the specific tests were negative. So she's like, okay, well, whatever, the doctors told me that. So shortly after that, she began having some stomach issues. She was having stomach pains and weight loss, and she's like, something is wrong with me. I don't know what it is. And this lady, like the three of us, use AI pretty commonly.
Like put in all the symptoms and stuff.
Right. So she goes to AI. It was ChatGPT specifically. She plugs in all her symptoms, and she starts asking, like, what are some more, unusual symptoms that are more unusual diseases that might cause these symptoms. Yeah. And so Chat suggested that she might have Hashimoto's disease, which is an autoimmune disease where your immune system starts to attack your thyroid gland, and then when the thyroid gland starts to function, irregularly, then you start to have all of these symptoms. Mm-hmm. So she goes to her doctors, and she's like, I can just see this going down. She goes in her doctor's office, like, yeah, I plugged all my symptoms into the internet, and the internet told me that I need to be tested for this. Because, I do have people come in sometimes, and they'll say, well, I saw on the internet, and so that can be good or bad, because, in this instance, it was good, but in some instances where it's maybe information that's not accurate, which we all know that's out there, then patients get in their head that they may have something that's not really true. So as a doctor, I see this as a double-edged sword. But in this instance, it was good. So she basically forces her doctors to test her for Hashimoto's disease, which she ended up having. That was correct. However, even crazier, one of the kind of normal follow-ups to that is to do an ultrasound of the thyroid. So they do that, and they find two masses, which were biopsied, which ended up being cancer.
That's wild.
Crazy, right? And so she ended up having I think she said she had a thyroidectomy to have those removed, and essentially she's cancer free now. But she, in her mind, ChatGPT saved her life, because if she had not talked to the ChatGPT and just said, okay, well, these doctors say I have rheumatoid arthritis, how many years would have gone by before these masses start to cause symptoms, and at that point, it might be too late.
That's wild. I wonder how many times that ChatGPT has saved somebody. and we don't even know it.
I don't know. It's funny that we are having this segment. I don't know if you remember, or if you may. It might have been. No, I think you were there.
We had a segment about it.
We had a segment,
and I remember when you told me about it. I gave the prompt to Chatgpt about a situation that happened to me when I had seizures.
And it got it right. Yeah, we did talk about this.
Because a doctor diagnosed me with just like severe migraines, and
Right.
I gave Chatgpt all of my. And this was before it was like super smart.
Right.
And I gave
Before it got super
Chatgpt
smart.
all of my symptoms.
And it nailed it.
And said
Yeah.
I was having semi-partial seizures.
Well, I mean, if you're interested in this stuff, we did a segment, and it's been a couple years ago now, where me and a general surgeon buddy, we came up with 10 diseases that were not rare, but maybe not something super common like high blood pressure. And we picked kind of random symptoms, not the number one symptom, but maybe like down the list. And so we were using Discord, and so I was on ChatGPT, and I said, okay, I think we said we were going to test you or whatever, so I didn't think that we were actually trying to get medical advice from it. But I started plugging in these symptoms, and it nailed all 10. It got all 10, nice. Eventually. Yeah, it was pretty crazy, and I was really surprised. So, if you're into that, you could check out that episode.
I used it recently for a health issue because I'm allergic to avocados, and my friend accidentally used avocado oil when she cooked food for me.
And you're like, am I going to die right now?
Well, I didn't know I had gotten literally food poisoned.
Did you get sick?
Yeah, I got super sick, and then I woke up with hives all over me.
And it was just the oil.
Mm-hmm. And I think it's just because it's so concentrated. But I was talking to ChatGPT the whole time. It was telling me hey, if this doesn't go away in this time, you need to go to the doctor, get a steroid shot.
Yeah.
And if the steroid shot doesn't, stuff that a doctor would say to me, but it was almost like giving me supplemental information, and it was urging me to go to the doctor appropriately.
Which it should be.
I was still talking to it after I went to the doctor, and it was still guiding me.
And then the doctor just said, and ChatGPT was like, yeah, he's doing all right.
Yeah.
Well,
it was making me feel better.
So,
anyways.
I mean, I think there's a lot of discussion to be had about this case and in the case that you had that, for people who are not familiar with AI, and especially the bigger ones, I think ChatGPT and Grok are both pretty reliable. I'm not a big Grok user just because I've been entrenched with ChatGPT since literally the first week it launched.
Yeah.
But Grok is pretty good by all metrics, and I kind of look at some of the metric comparisons. It's good. The other ones I'm not so sure about, but basically these AIs are the smartest resource on the planet. And so, if you come in talking about symptoms, it's going to make the connection. Now, the problem that I see it running into, and I bet this happened with her, and of course, they're always going to put the most positive spin on it, but I guarantee that when it started going through diseases, it didn't just say Hashimoto's. It probably listed out a bunch of things. Mm-hmm. And then, who knows, maybe she went to the doctor and said, I want to be tested for 6 different things that Chat suggested, and then one of them was correct.
Right.
So as I said, there's 2 sides to every story. And I mean, I totally believe that what happened, but there's probably more to it. And
probably.
So I think, when you're a person using the AI, you have to understand those limitations because, there might be some times where you plug in some vague symptoms and it's you might have pancreatic cancer, and then you start panicking. Mm-hmm. And, one of the things that I always say in medicine, which is very true, is that common things are common. And, unfortunately for her, autoimmune diseases give off very vague symptoms. Mm-hmm. And so, judging to the doctors, mess up here, well, I mean, obviously they missed something. Is that due to being a bad doctor or just bad luck? I mean, it's hard to say without, being there. But I can at least have some sympathy that, these autoimmune diseases are rare and common things are common. I mean, Hashimoto's disease does not typically present. It's you can't bend your fingers. That's just kind of a really vague, rare symptom.
Yeah.
And so in this instance, it's it picked. This particular instance is probably the best use for AI in picking out those really rare things. Yeah. And so I don't know. I think AI is very powerful, and I think we will continue to see AI, creep into literally every specialty of, employment. Mm-hmm. My specialty, your specialty. Even Trey's using it, and I think it's one of those things where you either adapt or die. I mean, if you're not using AI in at a few years' time, you're probably going to be at a disadvantage.
Yeah. I think it's helpful, too, whenever you use ChatGPT to let ChatGPT ask you questions. Mm-hmm. So, if you are sick, be like, pretend you're a doctor,
Oh, totally.
pretend you're this,
Yeah.
and ask me questions that will help you
Right.
find a diagnosis.
And of course,
kind of thing.
where AI is going to fail is at a certain point, you take enough history and you have ideas, but you do have to test people, right? And
Yeah.
so ChatGPT is not going to be able to draw your blood or send you down to get an X-ray.
They always say go to the doctor.
Yeah.
At the end.
It should, that's absolutely right. So, but yeah, I really enjoyed the story because I could totally see it happening. And like I said, there's probably more to it. And I'm not like blaming the doctors necessarily because who knows how it all went down.
Yeah.
But it
They're
is
all
just
just trying their best.
they're trying so hard. But it is interesting. And I think we're going to be talking about AI from here on out. I mean, without question,
Yeah.
whether it be on this show or just like in general conversation.
Mm-hmm.
I'm in pretty deep.
I know.
Yeah, I'm all in. I haven't actually. I don't really use it for work that much though. I use it
Yeah.
for everything else in my life. I don't have it like I have it suggest stuff for the show. I don't have it do my outline. I'm too OCD. I'll have it give me an idea. I have to do it myself.
Yeah.
I don't trust it yet. It's not good enough. It's getting there though. All right, let me recap this real quick, Trey. On today's episode, we were talking about this really crazy story where ChatGPT basically detected a cancer in a patient that she says the doctors missed. And long story short, this patient had some very vague symptoms, went to the doctor, and they gave her a diagnosis that actually wasn't correct. And when she started having more symptoms, she plugged all her symptoms into ChatGPT and it said, hey, you need to go get tested for this specific disease of the thyroid. Well, lo and behold, when she went and got tested, it was right, which then started a cascade of them doing further testing, including an ultrasound, which found 2 masses in her thyroid that she didn't know she had, which turned out to be cancer. Now, thankfully, got those cancer masses out and she's going to make a full recovery, but she's attributing ChatGPT to saving her life. And it brings up the discussion of AI basically creeping into every form of employment out there, including doctors. And, this is something that we in the medical field have been talking about, that, there are certain specialties where AI is going to have a massive impact. In my realm with surgery, probably not as much. We haven't taught these robots how to do surgery themselves yet, but who knows, that might be coming. So I might be replaced by a robot soon. You think the robot will sit here and do the podcast for me?
Isn't there like a surgical thing called like Da Vinci?
Yeah, Da Vinci. But so they call it the
played
robot.
with it one time.
Oh, you did?
Yeah.
So they call it the robot, but it's completely controlled by humans.
Yeah.
Yeah.
I got to mess with it when I had my internship.
It's
at a
kind of cool.
hospital.
Like I'll have to bring a picture of it. It looks like maybe like one of those bots that might kill you. It's got like a bunch of arms and
Yeah.
it's very intimidating. It's
looks
very
like
large.
it belongs in a factory.
Yeah, it looks like it may come to life and just go for AI
I wonder,
domination
like,
in a moment.
soon it'll be like you'd be able to like program it to do like open heart surgery.
Well,
or-
that's obviously the next big step is
Yeah.
teaching the AI to actually do the procedure. Because right now the robot literally is just the way it works is the robot's there over the patient and the doctor is 5 feet away in a I don't know what the proper word for it. It's almost like a sim pit where they like are using the instruments and looking through this like VR glasses, which are showing the cameras on the inside.
Yeah.
It's pretty crazy tech. I mean, honestly, if I'm being super honest, the robot is way overused. Like people are using robots for stuff that's like overkill, like simple gallbladder, simple appendectomies, things you can do in 15 or 20 minutes, but takes a couple hours with the robot. And I'm like, why are you doing that? But for like really complex stuff,
For
the robot's
science.
great. Yeah, for science. But yeah, I have I have mixed feelings about the robot. It is being overused. No one will tell you that, or I'll tell you. I'm just like.
Well, hopefully it's
"Blah."
gotten better since I used it because I think I messed with it whenever I was like.
It is very good.
22,
So like where
so
the
it was, like,
robot's great is like say if
while
you're
ago.
working in a really tight space, the robot's better than doing laparoscopy. Because the little arms are really small and you can do some very delicate work. But where they're using it for every surgery, I don't know. I'm against that.
Oh.
I'm gonna bring a general surgeon here. We're gonna have a debate.
Okay.
You wanna be there?
Okay.
Okay. All right. I gotta find one to come on though. It's hard
I'll
to
be
get
the
doctors.
buffer.
You'd be the buffer. Yeah, the referee.
Yeah.
All right, so I'm going to move on to our final topic today. And so I'm going to do just a general medical topic, which I like to do from time to time because we don't always talk about plastic surgery and health sometimes, or plastic surgery and beauty. Sometimes we talk about health stuff. And you're going to know about this because today we're going to be talking about stroke and recent trends in stroke deaths changing over the past 20 years. So stroke, 5th leading cause of death behind. You guys know it's a head of stroke. I bet you guys can nail almost all of them. I know you hate it when I put you on the spot. What's stroke's number 5? Name one of the top? You guys can name one, right? You each name one. I'll name the other 2.
Heart attack.
There you go. Heart disease. Trey, you got one?
I do not. Cancer.
There you go. Yeah, I knew you guys could do it. That's number 1, number 2.
Oh, there we go,
guys.
There we go.
Number 3 is accidents. Number 4 is still COVID, which I didn't believe that at first. And the thing is though too, like the data is always like a year or two behind. So, I don't know if COVID still is that high today. But as of the time that the data was, COVID was number 4. So stroke comes in at 5. And there's a new study that came out this month showing a big change specifically in stroke deaths. It came out in the PLOS journal, which was work from Georgetown and University of Washington. As always, I'm going to throw that study up there if people want to go look at it. Trey can toss that pick up. There's the study if anybody wants to check it out, but I will summarize it for you shortly. But first off, what's a stroke? You guys know what stroke is, right? Mm-hmm. Okay. Well, not everybody knows. So stroke basically occurs when the blood supply to part of the brain is interrupted, which obviously is a bad thing because you start to get cellular damage and eventually cellular death, which makes this a big medical emergency. There are 2 types of stroke. There is ischemic stroke and hemorrhagic. So ischemic strokes are far and away the most common, makes up about 90% of strokes. And that is when a blood clot or a plaque or just very low blood pressure just blocks or prevents blood from getting to your brain cells. Mm-hmm. The other type is a hemorrhagic stroke. This is much less likely. This is where the blood vessels in the brain actually burst. So you guys have heard of aneurysm. Mm-hmm. So like if you blow an aneurysm, that's a hemorrhagic stroke. So symptoms of stroke, we probably all heard these. They're typically sudden onset, things like numbness and weakness in the face, leg, or arm, which is usually one-sided, but not always. Sudden confusion, sudden inability to either speak properly or understand speaking, vision changes, dizziness, coordination loss, severe headaches. So those are the symptoms of stroke. There's a couple sayings regarding stroke in medicine. Because quick treatment of stroke is critical. So the 2 you always hear is time is brain, which basically means for every minute that clicks off after a stroke starts, brain cells are being lost. Mm-hmm. And the other one you hear is the golden hour, which means that when someone has a stroke, ideally you want treatment to be started within an hour, which is hard because people aren't stroking out in the emergency room. They're having a stroke at home or at the ball game, and then you got to get EMS to get them, and then someone has to figure out what's going on, call the right people. So it's actually kind of challenging to start treatment within an hour. But as I said, every minute that goes by, every minute there's like millions, 1 to 2 million brain cells die. Fortunately, we got lots of brain cells, so you can lose 1 million or so and still probably be all right. But you do want to get it taken care of as soon as possible.
Do brain cells come back? You can't grow those again, right?
Yeah, not really. Like nerve tissue is like the one thing in the body that does not really regenerate once it's gone.
That's what I thought.
Yeah. You can get limited amounts of regeneration, but not really. Like so, for example, when nerves get cut, you can repair them, and the nerve distally dies, and it will kind of regrow, but it's never kind of the same. Brain cells are even less likely to come back. I mean, if you have a stroke and you lose a bunch of brain cells, I mean, it's
I
really,
have dark spots in my brain from the seizure I had.
Really? Mm-hmm. They can see them on CT?
There. Yeah.
Interesting.
Yeah.
Well, you're doing very well.
Yes.
It hasn't affected you that
No.
much. Did it change your personality?
I don't know. I don't know. I didn't know if it was I
didn't know you before then, right?
No.
This is before.
It was a long time ago.
Yeah, okay.
It was before I had Avery. So it was over 11 years ago.
Yeah, very good. So treatment, how do you treat a stroke? Well, number 1, you want to restore blood flow to the brain. This is done by several methods. Thrombolytic, so if the stroke's caused by a clot, like a blood clot, then you can give medicines which break down clot. The other way is endovascular, so you can actually fish a little wire up the blood vessels and remove like a plaque, which is, you can't break down plaque with thrombolytics, so you can do that. And then finally there's surgery. That can be for really large clots that couldn't be broke down with fibrinolytics, or say for example there was a bleed and you had to go in and repair. Of course that's brain surgery, which that's really big stuff.
Can they put like stents in your brain like they do your heart?
Yeah, I imagine so. I mean, that's actually a question I don't know 100%. I'm sure they can if you had like a vessel. The problem with the brain is that, there's a lot of twists and turns, and so I don't know how good that they are with those wires. I don't know how far they can get up. Like, that's getting into knowledge that I'm just like, I know just enough to be dangerous about. Like, I know they can run wires up and do things, but the extent of what they can do is a little unknown to me.
Yeah.
But yes, they can do certain things, and I'm sure stents are some of them. It just depends on where it is.
Yeah.
You know, because as you go further and further, and you start to go like this, eventually the wire won't go.
Mm-hmm.
So risk factors for stroke. So there's modifiable risk factors and non-modifiable. So modifiable risk factors would be like high blood pressure, heart disease, diabetes, cholesterol, smoking, alcohol use, obesity, atrial fibrillation, and oral contraceptives.
Mm-hmm.
So those are things you can change. Non-modifiable risk factors are things like older age, race, African American race, higher risk of stroke, gender, men, higher risk of stroke, having a stroke in the past, or just family history.
Yeah. My
So-
grandfather had a stroke. He was bedridden for the rest of his
That's
life.
what my mom ended up having this year.
Yeah.
Yeah, that's terrible stuff. So, so what is this study? What did the study say? Well, I did a deep dive on the study, looked into it, and it basically was talking about the changes that have occurred over the past 20 years. And some of them are kind of noteworthy, and others are kind of like, So starting in 2009, the rates of stroke deaths started to go up, and that was after years of going down. So that is notable. It's like, okay, why are stroke deaths increasing? And we'll kind of do a discussion at the end. The other thing is that from 99 to 2020, patients who died at home from stroke rose dramatically from like 8% to 29%, and those that died in the hospital went from like 48% down to 29%. So where people are dying of stroke is changing. Again, we can talk about that. Rural Americans are much more likely to die in nursing homes or long-term care facilities versus hospital versus those in the city. That kind of digs into what is available and what location. You know, it makes sense. There's less hospitals in rural America. African Americans had the highest death rate in hospitals, which, you know, makes you want to dig into that information to see, is there something that we're missing? You know, why is one population, you know, having a worse outcome?
Yeah.
And then Caucasian people had the lowest hospital death rate, but the highest death rate in nursing homes and long-term care facilities. So again, what does all this mean? Well, so starting first with the increase in stroke mortality, it's probably due to risk factors increasing, because you can look at things like high blood pressure, obesity, heart disease, and if you see those things going up, then you're going to see an increase in strokes and strokes deaths. So, you know, the authors basically said, okay, well, it's not like that we're doing something suddenly wrong or there's something, you know, malicious going on. It's that the risk factors are going up, and when those factors go up, then, you know, strokes go up. As far as like people dying at home versus hospitals, that's probably due to the rise of things like hospice care.
Okay.
Hospice is a somewhat new phenomenon, or at least an accelerating phenomenon, where when people get to the end of life, you know, they're not just putting them in the hospital until they die, or, you know, in a nursing home. Like, you can go home, you can be at home, and people will come.
Like a home health
Yeah,
nurse.
like a home health nurse, a hospice nurse will come out and make sure you're comfortable and make sure, you know, things are not going off the rails, and it's a good thing. I mean, I don't know. I think I'd rather pass at home than in a foreign place.
Yeah.
And so I think hospice is, you know, a good thing for those that need it. And I think that this study is really seeing kind of the change in end-of-life care and reflecting that. So I don't think it's a bad thing. You know, the increase in African-American deaths in hospital, I mean, we know that African-Americans are more prone to stroke, and some of that's related to risk factors. Some of it could be genetic. I mean, certain ethnicities just have genetics to be more predisposed to certain things. I mean, we know that. And so, you know, I think with this, the main thing is to make sure that there's not like a lack of care, you know, that there's not some, you know, deeper issue with that.
Yeah, I think the key is always prevention. With
Yeah,
those
100%. Yeah, I mean,
we need to pay closer. We need to pay closer attention.
I think a lot of people aren't aware of like all the risk factors for stroke, and so, you know, a lot of them are things you can change. And so, you know, I think the study, honestly, I don't think there was anything groundbreaking in this study, but it's a good kind of reminder about, hey, stroke's one of the major causes of death in the United States, and these are how things are shifting. And I'm not sure it's as helpful as patients is for doctors, you know.
Yeah, it's important to get a primary care doctor and
Yeah,
go
and
for
them
your
knowing
normal visit.
Right. Absolutely. For the patient, that's critical. Like, get into a doctor and say, hey, what are my risk factors for stroke? I mean, it's the fifth most common.
And like getting your blood work done, taking your blood pressure, doing all those
keeping your
like
blood
little
pressure
things.
down. Make sure your heart's healthy. Keeping cholesterol down. Because cholesterol builds plaque, and plaque causes can cause strokes. So I think that this study didn't have anything early earth-shattering, but it's a good reminder that stroke still is a major cause of death and morbidity in the United States, and we need to keep on top of it. Keep up the prevention and try to prevent as much unneeded death and illness as possible. Yeah. So, all right, I think that's about it. I don't got anything else important to say.
Me either. I'm ready to go to Mexico.
I bet you are. I bet it's hard to come here today when you probably should be packed. Thank you, Sarah, for coming.
I have to write 2 papers too.
Oh my gosh.
Finish writing 2 papers for.
There's something that can help you do that.
Yeah, but you have to turn those papers now into turnitin.com, which reads to make sure that AI didn't write it.
Do you want me to tell you how to beat that?
Sure.
Okay, if you want to beat those detectors, first you write 10 papers, and then you plug those into AI and tell it, this is my writing style. I want you to write something in this writing style with no variation. And it'll do it.
Well,
I taught my daughter that trick. Now, I don't let AI write for me.
If my professors are watching this, no, I will not be doing that.
Yeah, Sarah's not going to be doing that. But that's the way you can beat those.
Interesting.
I have a lot of good information.
You know that there's like a lot of like software, like websites that are like getting people to pay them money to detect AI and then to rewrite it for them.
AI is just...
But they rewrite it in like, it sounds like a child wrote it. And like
It sounds like a child.
It's like weird.
Dude, AI is spawning so many new businesses. It's like when the internet came out and everyone's like, oh, this is cool. And then suddenly there's 10 million new businesses related to it. It's AI, man, I'm telling you. We're on the forefront. You and I, and Trey too, we're all on the forefront of this. We could do like an AI podcast. Sure. Trey laughing, and he's laughing at me there. All right, we got to wrap it up. All right, you guys, thank you so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Leave us a comment. We want to hear from you, and maybe we'll do a segment on a topic you want to hear about on the next episode of Nip Talk.
Bye.